Welcome to Workers Rock, a podcast that explores the fact that we have the power to change the culture of employment across the globe. Tonight on Workers Rock, Episode 3, we meet with 3 1199 SEIU representatives who are here with us to talk about the recent strike action against employer, the University of Rochester, why they had to do it, and the outcome of that action. Here in the studio, we have Tracey Harrison, Elizabeth Davila, and Robin White. I'm Amaret Miller, the host of Workers Rock, a part of the Labor Radio Podcast Network. Thank you so much for joining the show tonight.
Yes. Good evening, Amaret. My name is Tracey Harrison. I'm the Vice President for 1199 SEIU, covering the Rochester and Corning District.
Thank you.
Hello, this is Robin White, Amaret, and I am the Vice Chair Delegate at Strong Memorial Hospital for SEIU 1199.
Welcome.
Thank you.
Thank you, Amaret. My name is Elizabeth Davila, and I am an administrative organizer for 1199 SEIU in Rochester, New York, and I proudly represent the members at Strong Memorial Hospital and Anthony L. Jordan Health Center.
Thank you so much, Elizabeth.
Thank you for having us.
What did you win in this contract? What are the results of this contract? Tell me.
Respect. They respect us more than ever now. They see how strong and powerful the union can be. They understand dignity, what it means, and they're giving it now.
You're listening to Workers Rock, Episode 3, SEIU, The Strike, and the Outcome. So, Tracey, why do unions sometimes have to strike?
Good question, Amaret. Strike is not always the first action we're looking to accomplish. This comes after several different actions, petitions, stickers, march on the balls, conversations. When we find that we're just unable to get there with a particular employer, then we do look at a strike. And what is a strike? It's an opportunity for workers to be able to say, because you're not going to respect me today. You're not going to allow me to have the dignity and respect that I deserve in the workplace. You're not going to provide me with a living wage and good quality benefits. Then for you, I'm going to withhold my labor from you.
Okay. And tell me, what do the members of 1199 SEIU do in your unit?
1199 SEIU, we are roughly about 450,000 members throughout Massachusetts, New York, which is a large bulk of our members, New Jersey, Maryland, Florida, Washington, D.C. We are definitely the largest and fastest growing healthcare union in the nation. For my particular region, the Rochester Corning, we have about 14 facilities, nursing homes, hospitals, health centers, and now a new set of workers, home care workers.
All right. We're talking about the one-day strike against your employer, the University of Rochester, yes?
Yes.
Tell me more about that.
Well, unfortunately, the contract expired September 9th of 2023. Going into those negotiations, no one knew or anticipated that it was going to be quite a journey. We spent 4 months, a total of 33 negotiating sessions.
Wait a second. I've calendared these before. You literally had to calendar bulks of these.
Yes.
All right, keep going.
So with that, we found ourselves 33 sessions, 8, 10, 12, 16 hours, if not more, a session, in hopes that we were going to be able to reach a tentative agreement. Unfortunately, just was unable to get there for a variety of reasons. This was a very unique contract dispute. Typically, when you see disputes, it's normally centered around finances. An employer will say, we cannot afford X, Y, Z. What made these negotiations very unique is that this was for the first time in years to where we were able to come into these negotiations with a surplus around healthcare.
What does that mean?
That means currently in our collective bargaining agreement, the employer is required to pay 100% of the premium for health care for our members.
Wow. So if I worked for, let's say, Strong, and I was an environmental services worker,
Yes.
I would get 100% healthcare.
Yes, as long
Is that still true today?
it is true, very true.
Oh, we're going to get to that. Okay, keep going.
Yes. So going into these negotiations with an enormous surplus, we felt as though this would be a great opportunity for us to really now turn our attention away from the healthcare benefits and really focus on how do we start looking at wages, providing individuals, workers, their staff with a living wage.
Right. Tell me, how does the minimum wage becoming $15, how did that affect this contract?
It had a significant impact only because we believe strongly that no one, even with the minimum wage going up to $15 as of January 1, and
Here in New York State, I'll just remind
yes.
the listeners that this is in upstate New York, $15 as of January 2024.
Let's even kick the can a little bit further down the road. Minimum wage again will go up in 2025, January 1, of $15.50. And by January 1, 2026, it'll go up to $16. But if you were to look at the MIT calculator, this is an organization, they pull together data, information, and out of that comes what is considered a living wage, poverty wages. For us, looking at it, for two adults working in the home with one child should be making a minimum of $19.17 an hour.
Right.
So yes, the minimum wage did have an impact, but it still does not get the average worker close to a living wage.
Mm-hmm.
For a strong U of R, the URMC system, coming in the door at our lowest pay grade and our bargaining unit, they were making, before this contract was settled, $15.45 an hour.
No escalator clause? For those listening, the escalator clause typically ties to the minimum wage and kind of rises everyone up with it. And nothing like that?
Unfortunately, with this particular contract, it was not. What we've tried to do as much as possible is be proactive in terms of looking at what could a minimum wage increase look like, and just to ensure that we are not sitting at minimum wage.
Right,
So
and it causes buttoning, right? So like those who have been there longer or in other titles, like everyone's making the same amount if you don't adjust it through time.
Correct.
What are some of the jobs that your members do?
They, depending on the facility, it's really across the healthcare spectrum, but more specifically for the URMC, you will see environmental service workers, food service workers, transporters, linen, sterile processing, PSAs, which are the perioperative surgical associates, patient care technicians, dental hygienists, dental assistants, orthotic brace makers, across the spectrum.
So if someone comes in, God forbid, with a gunshot wound, your members are helping along the way.
They are, yes.
Okay. I'd like to direct some questions to Elizabeth and Robin. So how does member involvement impact an endeavor such as this?
Well, being that this is a union, we're all about the we. So making sure that we had the most amount of members out on that line was of the utmost importance, because that sends a strong message to the employer saying, hey, we're unified and we're going to withhold our labor until you give us what we deserve. So it's really, really important to have member participation, engagement, mobilization, all of the above.
Elizabeth, tell me, what did you do over the last few months? What was your work like? Tell me more about your job in this.
The way I've described it is it was grueling, because we're talking 15-hour days, multiple days in a row, and then being up really early to prepare for the strike, being there at 4 a.m, and it was a lot. There are a lot of facets to the work that I do, but I think that, it's a labor of love. It's a passion for me, being that I get to help others. I help raise this community and, in some small way, and I'm just very happy to that.
Thank you.
My work brings me great joy.
Thank you for that.
You're welcome.
Robin, tell me, what was this contract about?
This contract was pretty much about getting our dignity and respect that we deserve from the employer. Also, to have a living wage cost where we can live comfortable enough to survive instead of struggling constantly paycheck after paycheck, especially if you have a family of 2, 3, 4. I'm a single person, so it wasn't that hard on me, but I know that I had to fight hard for my brothers and sisters that I work with, that I communicate with, and just even fighting for not just our workers, but just within our community where the hospital is built at. Mm-hmm. So it meant a lot to me to go out on that line and fight and go to these meetings every day, being there early in the morning and sit at that table and have discussions with the head people at the hospital about what we expect, what we want, what we're not going to give into. And we fought hard.
Let's go back to March of 2020. What was the pandemic like for your members?
It was probably the toughest time that many of them have ever had to experience. Mm-hmm. You had individuals coming into work, still committed, showing up, willing and ready to provide the highest level of patient care and services, and to be confronted with the unknown. You had individuals working in the nursing field who witnessed individuals passing from such a horrific pandemic. In some cases, you had individuals taking that same virus home. We had folks who had passed away that we've known. Fear was definitely high, but I think the commitment that these folks had, continues to have, was just, it was courageous.
Mm-hmm.
You're listening to Workers Rock, Episode 3, SEIU, The Strike and the Outcome.
Tell me about Bruce Popper.
Bruce Popper.
Who is Bruce Popper to SEIU 1199?
Bruce is an extraordinary individual, human being, who gave so unselfishly, who made a significant impact on our society. This was someone who his life was fully about the labor movement. That's what he did. There are some folks who are lawyers, doctors, radio personality individuals. Bruce was an organizer. He was one who strongly believed in building collective power, fighting to ensure that workers had a voice, a collective voice, and was willing to do whatever it took to ensure that dignity and respect that we talk about, that social and economic justice that we talk about, that fairness and equality that we talk about, that it was realized throughout our members' employment. Many levels to Mr. Popper, many levels.
Thank you so much for that, Tracey. I know he means so much to not just you, but every single member of SEIU 1199 in the labor community, not only in New York State, but throughout the country and the world. He had such an impact, so my condolences.
You're listening to Workers Rock, Episode 3, SEIU, The Strike and the Outcome.
Contractually, what did you win in this contract?
Well, quite a bit. I think taking it from just the basic foundations of improvement, I think Robin really hit it on the head. Dignity and respect, there's no amount of money that can really be placed on that. It is something to be said, though. You know what it feels like. You know what it looks like. You know what it sounds like. And I think from this contract fight, unfortunately, a lot of that now has really come to the surface. And I think that the employer knows that this is mandatory, that it has to exist in this system. When we look at it from an economic standpoint, we were able to accomplish many things. We were able to accomplish first getting workers to as close to a living wage as possible. Meaning what? Our lowest pay grade coming in the door now will make no less than $17 an hour in the first year of the contract.
That is excellent.
By the third year, beginning of the third year of the contract, they will make no less than $18 and I believe 48 cents an hour in our lowest pay grade.
This is how we solve poverty, Tracey.
Yes. That's the wage piece of it.
Mm-hmm.
We wanted to focus on three pieces. One was recruitment and retainment. How do we get folks to come in the door and stay? We wanted to focus on retainment. Would it surprise you to know that we have folks who have been employed there for over 50 years? 50 years, and it is something to be said about that. So we wanted this contract to reflect longevity, recognition, that they appreciate these individuals and their commitment. And then there was the middle group where we wanted to ensure that they were recognized as well. They did not have to wait forever to see a decent wage increase. So we were able to accomplish that. And to your point, Amaret, it also allows us to put a dent into that poverty piece, which, by the way, Rochester has one of the highest levels of poverty and child poverty. Mental health has gone up. Studies have shown that mental health there's a direct correlation with poverty. So in looking at all those factors, we knew going into it that wages had to really be the center of it all. So we were able to adjust to fight for good wages, better wages, healthcare. When we look at our members, we look at the whole member, employee, worker, meaning, yes, it's great to be able to have a good wage. We want to make sure that that happens. That's imperative. But it's also crucial to ensure that individuals have good quality healthcare benefits, to be proactive in their care, and to be able to just have the overall services that they need so that they can have a good, healthy life, not just for themselves, but also for their families. That healthcare plan or premium, this employer is responsible for maintaining that. So we're maintaining that. That is excellent with low copays.
Right.
Next, childcare. We know that childcare can make a difference on whether a person keep a job, lose a job. We have a childcare fund that has been established. In this contract, we were able to increase the employer's contribution. So our members will see more money that can be allocated towards childcare with no strings attached. Just being a member, if you have children, you provide the necessary paperwork, you will get multiple stipends throughout the year, which is a beautiful thing.
Question, Tracey. Did you also get a percentage raise, like across the board? Like, what did those look like?
Sure. When you look at the first year, the wage increases, it was on an average depending on the classifications, meaning what? When you look at the lowest pay grade, obviously those percentages would be a little bit higher because it was going to take a lot more to get them up. We have an across the board first year on average between 6% to, I want to say, about 15 to 16%. Just really depends on where you fell at on the scale.
Woo! Nice.
So
I know they needed it, so it's not like it's, it's long due. It's long overdue. I know that.
Definitely. So that's in the second year, it's 4%, and in the third year, it's 4% as well. We knew that the first year of the contract was going to be the biggest lift for the employer. And then the second year, third year was really ensuring that we can continuously stay out in front of the minimum wage and start building upon those wages. Right now, Elizabeth, as the administrative organizer for this facility, once that contract was ratified, her job now has really been about focusing on ensuring that the things that have been negotiated in that contract are being implemented. So a lot of committees, as I've mentioned, a lot of economic improvements, and overall, the basic dignity and respect has been established. And I think that I would like to believe overall, matter of fact, I know on our end, when it comes down to our membership, they are extremely excited about what they were able to accomplish. I believe strongly that the employer is comfortable with the outcome of these negotiations. No, again, like I said, no one wants to strike. We had, to Robin's point, we had a lot of folks even throughout management who were well in support of what we were doing, why we had to do it. And I think that just overall, that really helps send a very strong message to this employer, and the outcome we are just all very, very pleased with.
Oh, that's a beautiful contract. Congratulations to you, the leadership team, every single one of the members. Tracey, what would you like to say to your members, those who were involved, and the community who supported you in this strike and leading up to it?
I will say that it was extremely evident that we have some of the most courageous workers out there who were unwilling to compromise their value. They were willing to stand up and call the question on the employer and put the necessary pressure on them to ensure that they got what they deserve. Partnerships matter. Relationships matter. And we were really able to make that work for us. Whether it was clergy groups, we had the pastors out there working with us, different community groups, our elected officials across the board, state delegations came out, wrote letters, support letters, upstate, downstate. We had folks who traveled from different areas to come and walk that picket and strike line. Most importantly, again, it goes back to my mentor, my friend, Bruce Popper, saying, you get the workers, you win. You don't have the workers, you lose.
All right, Elizabeth, Robin, Tracey, thank you so much for joining us on Workers Rock tonight.
Yes.
Thank you for
Thank
having
you.
us. Thank you, Everett.
We appreciate it. Definitely.
All right, I might have to apply for a job with you guys. If people want to apply for jobs at the U of R to become an SEIU member, do they just go to the U of R site and kind of search their careers?
Yes.
Yes.
Awesome. All right, thank you so much, and see you soon.
That concludes this episode of Workers Rock. Thank you for listening.